I'm a biologist and a researcher, so with a background in biophysics and math. So basically, I look at the data as if they were results of an experiment in which I know the input and the output. So, for example, this one, I could see it as a cell culture, as cells on the petri dishes that somebody planted on a petri dish, then gave it some food, then the cells were growing, but then they got no food, so they started no more food, so they started dying out, and they almost starved to death. But then the student came back to the lab and fed them a little bit more to rescue them, and they were growing back again. And then he fed them even more nutritious medium, and then they grew even more and started basically, in effect, we got a thriving cell culture. But it's not a cell culture on a petri dish on this graph. It's those are the COVID-19 cases in Alberta. But the pattern is very similar. So when we have a shutdown and restrictions, the cases are going down. But when we ease the restrictions, the cases start grow up. And if we ease the restrictions even more, they start to shooting up. And the pattern is exponential. So to check if it's really exponential, I put the graph on natural logarithm scale, which is 1, 2, 4, 8, 16, 32, 64. And then on such a scale, if something is exponential, then the data can fit into make a straight line. That means it's exponential if it's straight line on logarithmic scale. So here we have basically in most situations, till now, there are two basic rules of SARS-CoV-2 spread. So the rule number one, that if the restrictions plus vaccinations are not sufficient, then cases grow exponentially. So there are those two cases. When restrictions plus vaccinations are sufficient, then cases decline exponentially. And if we keep the restrictions and vaccination long enough, then they can decline down to zero and stop the spread. And so here we come to the rule number 0, basically, that if we have no starter cases, then no matter what conditions, cases cannot grow, because nothing can grow from 0. So basically it's something like 2018, when there was no cases. Doesn't matter how much we would party and how big events we would have no COVID, because there was no COVID starter cases. So from here, I can, when I have this straight line on logarithmic scale, so I know it's exponential, I can fit this to the exponential growth equation and calculate the doubling time of this curve, and then plot it again on the regular scale. So that's the same data, just on the regular scale. This is our exponential growth, and I know the doubling time, and knowing the doubling time, and I can extrapolate it and predict the nearest future. So assuming that the conditions won't change, this extrapolation can be pretty accurate. So here I predicted 2,000 daily cases at the beginning of December and 4,000 by Christmas. Fortunately, this 4,000 didn't happen because we had restrictions in place before Christmas, so we never reached 4,000 daily new cases. That's another example of the projection graph, here illustrating the variant growth, B117, and the same principle. So using the published data, the B117 observed cases, I can calculate the parameters, so the doubling rate, and extrapolate it, which is the red dashed line. Then also calculate the spread of the original variant and extrapolate it, then add those two lines to have overall cases. And that was, again, pretty accurate estimation. And actually the reality turned out more brutal, so we reached 2,000 cases a little bit earlier than in May. Here's the optimistic graph illustrating by the same method how close we are to 0. So basically, almost any time in last 1.5 years, we've been sometimes as close as just 4 weeks from reaching zero to 8-10 weeks maximally. So it's almost all the time it's within reach. Just if we would make the decision, we could get there together with having vaccines and public health restrictions. And here's an example of another graph, which is not based on measured data. It's more conceptual. And I wanted to show here that getting the R value just below 1 is not enough. We need much more, because if we have the R value just below 1, the spread will, and start from large numbers, the spread will still continue for quite a long time, and we will have still a lot of cases and a lot of deaths. But if we bring the R value down to 0.6, then we can reduce the number of cases. I think we basically can stop the community transmission in something like 2 months. So very quickly end the suffering. And so to draw the graphs, I try always to make them as simple as possible. So for example, this graph had, at the beginning, it had like 3 times more text, but then I chopped it. So it's iterative procedure. And to leave at the end just the most important facts on it. And for the tools, I use a combination of GraphPad Prism biostat program combined with Excel and PowerPoint and a set of crayons. And then I'm tweeting it. So it's an example of one tweet. First I compose, and it's again, it's anybody who tweets knows that's iterative process. Fortunately, in Twitter, you have to limit the number of words, which is actually very, very good because it keeps it compact. But also I try to put the most important, everything I want and the most important message in the first tweet of the thread. And then the next, because most people just read the first tweet. And then the next important part, except of posting it, is that if it's the message that I find particularly important, I try to direct message with a personal note. The influential people, decision makers, and the journalists, it will be probably 20, 30 different people, and then they can carry this message further and probably influence some change. So thank you very much for your attention, and I'm happy to answer questions.